The House of Representatives has raised concerns over decreasing effort by the government to contain malaria in the country. Spokesman of the House, Mr. Benjamin Kalu, and two other lawmakers in a motion titled "Call for Intervention in Nigeria's Losses in the Fight Against Malaria" at the plenary on Wednesday. Our correspondent brings a report.
The spokesman of the House, Mr. Benjamin Kalu, while moving the motion, co-sponsored by Mr. Yusuf Sonono and Mr. Abubakar Dahiru, noted Nigeria loses over $1 billion yearly in the prevention and treatment of malaria, alongside other costs, despite efforts to contain the disease. He expressed concern over impending consequences of the country's poor performance in malaria control.
The House is concerned by a recent report from the Office of the Inspector General of the Global Fund, indicating that NNEP has fallen from a grade known as B1 to B2 rating within 6 months. The House also is concerned that, considering that Nigeria is one of the biggest beneficiaries of the Global Fund grant, with a value of $412 million, the country is at risk of losing the grant and other partnership opportunities as a result of poor absorption, poor performance, and lack of domestic resource mobilization.
The House, in adopting the motion, resolved to invite the leadership of the National Malaria Program to provide explanations on some gray areas, including while defective mosquito nets are still being procured, imported, and distributed in Nigeria, against World Health Organization standards and local content directives from the House. Meanwhile, at the committee level, stakeholders in the health sector registered support for an amendment bill seeking to restructure the composition of the governing board and review the nomenclature of heads of hospitals, among others. This is as leadership of the House and stakeholders in the health sector, as well as community leaders, expressed support for two bills seeking to establish and upgrade Wesley Guild Hospital, Ilesha, to Federal Medical Center in Osun State, sponsored by Mr. Lawrence Babatunde Ayeni. Briefing members of the press after the public hearing organized by the House Committee on Health Institution, representatives of the Joint Health Sector Unions, JOHESU, further made reservations and recommendations.
It has shown that it is not the title you bear as a chief medical director that matters. What is your managerial skill? And that's what we are asking for. This bill is driving to correct this anomaly so that at the end of the day, the patients who are the reasons why we are in the hospital, we have maximum and efficient healthcare service delivery offered to them.
Speaker of the House, Mr. Femi Gbajabiamila, declared the hearing open through his representative, the Majority Leader, Mr. Alhassan Adodogowa, expressing optimism that the legislation would strengthen the country's healthcare system. Rosemary Kokotiga, ASO Television News.